Welcome to this segment of the Evidence-Based Clinician, where we present on a clinical topic that you can use today to improve your patient's functional outcomes. My name is Michael Wahm, a physical therapist and co-owner of Active Life and Sports Physical Therapy. Today's topic is cervical radiculopathy. In their 2003 study published in the journal Spine, Wainer et al. Identified a cluster of 4 tests that, when all were present, had a 30.4 positive likelihood ratio for cervical radiculopathy. When all were negative, there was a 0.12 negative likelihood ratio. Those tests were So today we're going to take a look at those 4 tests to help us identify cervical radiculopathy. The Spurling A Test is performed by having the patient rotate slightly toward the involved side and side bend, and we apply approximately 7 kilograms of overpressure. The test is positive if it reproduces the patient's upper extremity or scapular symptoms. Cervical active range of motion is tested with the patient seated using a standard goniometer. The stationary arm is lined up with the acromion process. The patient is asked to turn to the right. Cervical distraction is tested by grasping the patient at the base of the skull and under the chin and applying a force of approximately 14 kilograms. The test is considered positive when it relieves the patient's upper extremity symptoms or scapular pain. The upper limb nerve tension test starts with depression of the scapula, abduction of the shoulder, external rotation of the shoulder, extension of the wrist, and extension of the elbow. We can then test with lateral bending of the head away from the arm and lateral bending towards the affected arm. The test is positive if side bend away from the affected limb increases symptoms, if there's a 10-degree difference or more between the affected side and the unaffected side, or if symptoms are reproduced, or if extremity symptoms are reproduced by the test. So the next time you're faced with a patient with upper extremity symptoms and you're trying to differentiate between a local problem and a cervical radiculopathy, be the evidence-based clinician and try to look at this cluster of 4 tests